Hi, I'm Jennifer Fjarki. I work for the Association of Food and Drug Officials as a project manager. And today I'm going to be giving the presentation that I gave at IAFP this past week on the recall project that AFTO has been doing over the last 2 years. The particular session was called Improving the Food Recall Effectiveness of Regulatory Agencies. And if you have an opportunity to go back to IFP and listen to the recording of the full session, I would highly encourage you to do so. It was a panel discussion. It included remarks from FDA, Georgia, Missouri, as well as Stop Foodborne Illness. But these are just my comments that I provided during that session. And today I'm going to start from reading from a book for you all, from The Poison Squad by Deborah Bloom. Hopefully many of you have picked her book up, or you recall her speaking at our AFTO conference a couple years ago when we were on person. And she provides some really great insights to the beginning of my presentation. So in her epilogue, she states, "The story of consumer protection in the United States is often the story of a country playing defense, an account of government regulators waking up time and time again to yet another public health crisis. The 1906 Food and Drug Law, which established federal food regulation, was propelled into being largely by a series of scandals over food processing, including the gruesomely spectacular case of the Chicago meatpackers. The 1938 law, which created the modern US Food and Drug Administration, was passed following the deaths of dozens of children who were poisoned by a cough syrup legally sweetened with an antifreeze ingredient. A 1956 decision by the FDA to ban some of the old coal tar dyes arose from the sickening of children by Halloween candy that contained unsafe levels of orange and red coloring agents. Then an 1876 law authorizing the agency to regulate medical devices was passed after some 200,000 women reported injuries from an intrauterine birth control device. More recently, the Food Safety Modernization Act, FSMA, a sweeping update to the FDA's protective authority, was signed into law after one of the most severe food poisoning outbreaks in American history, one that continued for months, from late 2008 to early 2009, and derived from one of the country's most trusted and ordinary food staples, which of course, as many of you know, is peanut butter. So why provide all this information? Because history is important. It affords us the opportunity to learn from our mistakes and successes so we can avoid the first and repeat the second. The idea that public health policy is largely passed when bodies are in the street is not a new concept to many listening. It is an unfortunate truth. The passage of FSMA was due to a long history of outbreaks, recalls, illnesses, and deaths. Peanut Butter Corporation of America was the last straw. Peanut Butter Corporation of America's recall was by far the largest recall ever to take place. Over 3,600 products, 700 illnesses, and 4 deaths, according to the CDC. The recall expanded 3 times after the initial recall. The opportunity to learn from the past recalls has never been richer. However, the history of recalls in the United States has another storyline. This story begins in 2000 and stretches to present day. The Government Accountability Office reported on the need for recall reforms in 2000, 2004, and 2012. Additionally, the Office of Inspector General, OIG, produced a report on recalls in 2017. All reports focused on FDA's recall procedures and processes. USDA, FSIS received attention as well, but only in 2000 and 2004. The focus of my research is on FDA, But USDA FSI is still an important part of this conversation. So why, again, does all this recall history matter? All these reports that I just spoke of were responded to by FDA. All this attention over the years on recalls should mean our recall process is beyond the need for improvement. The unfortunate reality is history is doomed to repeat itself. Yes, FDA responded and made updates, but the hard truth is it's not enough. The improvements do not go deep enough to institute the real change needed to make recall response truly streamlined. Over the last 2 years, AFTO has worked with a handful of states-based rapid response teams, 2 which are present on today, Missouri and Georgia, and various key industry members to learn from the past, to analyze our recall pain points and to gather data, understand why these pain points exist. The energies of this dedicated work group culminated into a white paper that will be released in the coming weeks. AFTO did present some of their early findings to the FDA recall team and the Office of Enforcement, as well as spoken to stop foodborne illness. The white paper is meant to analyze the past so we can better protect the public going forward. The findings offer a constructive criticism of the FDA recall process with the express goal for a cultural shift in how we think and do recalls. The white paper contains well over a dozen recommendations, findings from 3 different surveys, and an analysis of the aforementioned reports, plus digging into the significant historical food safety events and policies that impact recall policy since 2000. The 2 premises of this paper are: 1, consumers continue to become ill from recalled products that are consumed after the issuance of a recall. And 2, recalls are issued so late in an ongoing outbreak investigation that their effectiveness from preventing further illness is called into question. As I said, there were many recommendations in the paper, so I'm going to focus in on some key themes from the data. The first, urgency. The paper points to the need for accelerated recall response for Class 1 recalls. It is our public health mission to protect consumers from adulterated food, not through an overabundance of record collection and evidence, but by moving quickly with good data to issue a recall closer to the top of the epidemiological curve. States and local jurisdictions carry the consequences of foodborne illness as they live and work with those negatively impacted by the adulterated product left on the market. States and locals are equally, sometimes more, than FDA held responsible for illness and deaths due to recall product. The paper lays out the need for better information sharing, communication beyond just the sharing of distribution lists, and plainly, inclusion. While many states are not able to respond to recalls, there are currently 40 states who are enrolled in the Manufactured Foods Regulatory Program Standards Program, and over half, 32, are in full conformance and are equal to the task of responding to recalls and protecting their consumers if included in the recall response conversation. FDA needs to better utilize these relationships and create a food safety culture of urgency around Class 1 recalls within their own agency and with their state and local partners. The second theme, consistency. The data showed a clear need for consistency of response across FDA divisions and states to recalls. So 2 points. Our industry members communicated the desire for recall data requests to be the same regardless of where in the nation the recall was taking place. It is common states and FDA are both asking for recall records like the distribution lists from the recalling firm. This causes a lot of stress to the industry with multiple regulatory entities are asking for data that presumably we, the regulators, should be sharing with each other. The issue is if states receive a distribution list from FDA, they are limited on who that list can go to within their state. If states seek the distribution list directly, they are able to share that list much more widely and are better able to target the recalled product all the way through the retail chain and to places like food banks or small independent groceries to pull recalled product off the shelves. Point 2, The recall audit checks, or we call them 3177s, are an important part of ensuring recall product is off the shelves and that firms throughout the food supply chain are following recall instructions or simply are aware of a recall is taking place if no communication was received. There is no national recall audit check training for states and FDA. States are left to sort out how to fill out these forms, and despite the FDA's Investigations Operations Manual, IOM, listing the instructions for this form, many nuances and distinctions are found on how to fill out this form across FDA divisions. Overall, training would be my third major theme. FDA and states do not train together on how to conduct recalls, and this is a key factor in the inconsistency of recall response. My final thought, and I would be turning this over at this time to the next speaker, is a need for cultural change within FDA. FDA needs to re-examine the values around recall response and ensure that all those within FDA who work on recalls believe in those values. Deputy Commissioner Frank Yanis has spent a lot of time promoting food safety culture, a cause I admire. But I know culture is one of the hardest things to change in an organization. FDA needs to be all in on fundamentally reevaluating and changing recall culture. The culture created around recalls will be the glue that binds states, locals, and federal agencies all together. I want this white paper and the recall work Stop Foodborne Illness is doing to be a start of a conversation about how to create the all-in culture on recalls we need. Because if we either succeed or we fail together, and if we fail, we repeat history, and some terrible recall in the future should not be the tipping point for meaningful change, as it has been so many times in our food safety past. So if you have questions about this presentation, please feel free to reach out to myself or to AFTO, and we'll be happy to respond to you. Thank you so much for listening.